Welcome to today's webinar on physical activity for the Be Active Plus champions. So this webinar is to support you in delivering brief advice and interventions to enable the people that you connect with to become more physically active. I'm Dr. Lassamani, I'm the Director of Public Health for Birmingham City Council, and I'll be giving today's webinar. So first of all, let's start off by defining the difference between physical activity and exercise. Sounds simple enough, but they're terms we use every day. But actually, we don't often spend time talking about what do we really mean when we talk about these different terms. So physical activity is any bodily movement which is produced by skeletal muscles that requires energy expenditure. So this is talking about reaching up to the sky, touching your toes, twisting around, things that use the muscles that connect between your bones. They're your skeletal muscles, and you're requiring energy to make that movement happen. Exercise is a form of physical activity which is planned, it's structured, it's often repetitive, and it's got a purpose to being. Now that purpose might be getting fit, that purpose might be chasing a ball around a soccer pitch, that purpose might be being the best dancer on the dance floor. But exercise generally has a purpose, and it is a structured time. It's something you're intentionally doing rather than, for example, breathing, which is something unconscious. We often talk about physical activity in the context of people who are active and people who are inactive. And in the UK, we use the definition of less than 30 minutes of moderately intense physical activity per week is people who are inactive. And when we talk about moderate physical activity, we're talking about activity which gets you a little bit warm, a little bit breathy, but you can still have a conversation while you're being active. Vigorous physical activity is when you're really working out, you're getting that sweat on, and it's quite hard to have a decent conversation when you're doing vigorous activity. But people who are inactive in the UK are defined as doing less than 30 minutes of moderate physical activity on average each week. So how much should we do? Well, some of the research shows that many health and social care professionals aren't actually familiar with the Chief Medical Officer's guidance. And this is what it says. For adults, all of us should be achieving at least 150 minutes of moderate physical activity every week. Now, that can be through all sorts of forms: cycling, walking, dancing, running, doesn't really matter. You can also be active instead through 75 minutes of vigorous physical activity. And that's where you're really working out hard. So that might be a really active game of football, it might be working out in a spin class at the gym, something like that. It's also important that in at least 2 days a week, we do muscle strengthening activity. That can be working out with weights, it can be doing resistance activity using body weight, it could be lifting bags of shopping or doing activities like yoga. As we age, it's really important we invest time in balance activity as well, and we should be doing that at least 2 days a week. Balance activity is things like dancing, tai chi, playing bowls. Things that require us to think about a bit of hand-eye coordination, spatial awareness, and balance. And we know that balancing activity as we age is a really good thing that reduces the risk of falls and of fractures. The other thing that's really important we do at every age is reduce the amount of time we spend sitting. Ideally, we should be trying to break up every hour with getting up for at least 10 minutes and moving around. But the realities of today's workplace, where we're often sat at a computer listening to a webinar like this, means it can be a bit hard. And that sedentary activity can add up. And we know that that can quite rapidly damage your health. So being active is not good enough. You've also got to break up that sitting time. And it's doing those things together, breaking up your sitting time, being aerobically active, building your strength through muscle strengthening activities, and working on your balance at every age and in every community will make a real difference when it comes to health outcomes. What's important in terms of the evidence base is to know that it has changed. Recent guidance last couple of years from the World Health Organization has said that it's no longer important that you do your physical activity in 10-minute bouts. Now you just have to get active, and every minute, every movement counts. We know that the more you do, the better the benefit. But over 150 minutes of moderate physical activity is where you're really reaping the best rewards. You continue to increase that, the more you do, up to about 300, and then the benefit for every extra 10 minutes of activity flattens out a bit. The real gain is made in that moving from 30 minutes up to 150 minutes. We know that's the point at which people really start to see health benefits across their physical and mental health. And it doesn't matter if they're doing 2 minutes here, 5 minutes there, half an hour there. It really should be scattered through the day, and it should be on every day of the week. We really want people to be active every day. When we look at physical activity in Birmingham, we've got a bit of a way to go. That dark blue line in the middle of the graph is the number of adults that aren't achieving 30 minutes of physical activity every week. And as you can see, it's sitting pretty stubbornly at about 32%. And unfortunately, we can't blame this on the pandemic. This situation has been around for a while before that. The proportion covered by the red line are the people that are between 30 and 150 minutes. So they're on the way to really improving their health. And the top line, that 54%, which sits at around 54 to 59%, is the people that are achieving 150 minutes. So about half the adults in Birmingham are doing okay, but that means about half of them aren't, and they could do more to really improve their health and well-being. And that's really important for us as as Bolder Healthier champions, that it's an important part of what we do every day when we make every contact count and we nudge people and we support people and we encourage people to being the best they can be through the activities that they take every day. So why does it matter? Well, the Chief Medical Officers of England said a long time ago, if physical activity was a pill, we'd be popping one every day. It is one of the 3 causes of premature death, physical inactivity, sitting right up there with smoking and unhealthy diet, and just ahead of things like alcohol and substance misuse. Physical inactivity costs the NHS every year over £900 million in diseases and treatments that could be avoided if people were achieving that 150 minutes of moderate physical activity every week. Being active every day, we know, reduces the risk of not only developing over 40 different diseases and conditions, but if you have conditions like diabetes or high blood pressure, we know that being active improves your clinical outcomes. It reduces your need for treatment and it reduces the risk of complications. Physical activity really is a wonder drug. And if it was as easy to pop as a pill, everyone would be clamoring to take it. These are just some of the forms of health that can be improved by physical activity. You have the slide deck, which has the references, and if you have a look at the Chief Medical Officer's guidelines, it shows you even more of the health conditions that the risk can be reduced by being physically active. And that includes conditions like cancer. Breast cancer with brisk activity can be reduced by over 20% in terms of the risk factors for women. We know that hip fractures can be reduced by over 68% in people that are physically active every day. And overall, in terms of all-cause mortality, we can reduce it by almost a third by getting people up to that 150 minutes of moderate physical activity every week. Physical activity really can make a difference when it comes to people's lives, both in terms of their mental health and their physical health. And the benefits are across the whole life course. We know that in early life, being physically active as children really lays the foundation for our musculoskeletal system. It increases our heart function. It also improves our brain activity. And there are good trials which are showing evidence around educational attainment, social interaction in children. Play is a really important part of children's development. As we go into adult life, being more physically active improves outcomes for pregnancy. It has impacts in the menopause and across a whole range of diseases that can, as we grow older, become disabilities. So there are a whole load of things where being physically active at every single age will make a difference. And even at the end of life, with some of those conditions which we really struggle to manage, like fatigue and tiredness, being physically active, a gentle 10-minute walk a day in people who are at the end of life can clinically reduce their symptoms of fatigue, a symptom we don't have a great drug for. So it really can make an impact from birth until death. In fact, from conception to death, being physically active matters. There's lots of consensus statements. There's lots of evidence out there showing that the benefits of physical activity outweigh the risks. The risks for physical activity for the vast majority of individuals are extremely small. For a small proportion of people with unstable heart conditions, they should be seeking medical advice, but there are still things that they can do. And there are still ways to be physically active, particularly around balance and stability and muscle strengthening safely, even if you have some significant health challenges. So it is about being person-centered. It's about working with the individual you're with to have the conversation. Different types of physical activity work for different people. By nature, we're promiscuous in the type of physical activity we like to use. Some of us are dancers, some of us are runners, some of us are walkers, some of us are mountain climbers. There are lots and lots of different ways to be physically active, and that takes into account someone's culture, someone's health status, someone's age. Working with a person to say what works for you, try different things, giving them the encouragement is what being a Bolder Healthier Plus champion is about. So why are the health benefits not being shared? Why are people not really getting on top of this? Well, we know from some of the research that's been done that actually many healthcare professionals are just not familiar with knowing that 150 minutes of moderate physical activity is what we should be aiming for. And even if they do know it, they feel a bit uncomfortable having the conversation. They're not sure how to have the conversation and how to raise it with patients. We know that there's work being done to increase the education, particularly in medical school, but also across other health professional training and in other settings to support people to have these conversations. And whether you do it as an undergraduate and as part of your training, or you do it as a postgraduate through some of the physical activity clinical champion training that is available, there's lots of advice out there. The other thing people are worried about is that it's going to take time. And we're often really pressured to try and cram in all of the things we need to have conversations with our clients about into those appointment slots that we've got. But there are interventions, there are ways to make it work. And we know that if a healthcare professional or a social care professional or a trusted individual gives someone the advice to be physically active in a way that is person-centered, recognizes their situation, gives them that little bit of encouragement and nudge, we know that it makes a difference. And there's good evidence that very brief advice, a couple of seconds in a consultation, in an appointment with someone, will make a difference and can nudge them that little bit closer to the 150 minutes. You'll be very familiar as Bolder Healthier champions with making every contact count. And physical activity advice is a really easy way to integrate this into your everyday practice. Thinking about how do you have a conversation with someone about how active they are there things they enjoy? Even opening up the conversation of, have you had a walk in the park? Did you go out and see some of the stuff that was going on in the Commonwealth Games? However you open the conversation, getting a sense of how active someone is can be a really useful way of connecting with them and finding out a bit more about their health, their well-being, their social isolation, their connection to their community. Making every contact count is about communicating these messages in everyday practice. And part of these webinars is about giving you the knowledge and the skills, some of the information, some of the facts to back it up with, but also connecting you with some of the support that is out there. There is lots of advice and support about how healthcare professionals, and this applies to social care professionals, to teachers as well. It's really transferable for this one. You don't need a medical degree to make it count. But actually, if you're on the patient side and you've got a long-term condition, sometimes you do need someone with a medical degree or a pharmacist or a nurse, someone who is healthcare trained to give you the confidence to be physically active and to help you understand that it will make a difference for you. So there is a lot of support out there to help health professionals and champions to get people active every day. There's a Moving Healthcare Professionals programme, which is funded by Sport England. They produce training, which is available for healthcare professionals. And in Birmingham and across the West Midlands, that training is free to access for local healthcare professionals. So short training, there's also e-learning modules, and it can be a really good way of just boosting up your confidence. It's got lots of helpful hints and tips. It's written by healthcare professionals in practice, and it's designed to help you understand how you can just build this into your everyday consultations. It's not about blocking out special time for the conversation. It's about weaving it in again and again every time you're in contact with patients to build their confidence and to build their awareness that physical activity can make a difference for them. Moving Medicine is a brilliant resource. We're really lucky in Birmingham because they've worked with us on a specific Moving Medicine platform around Birmingham. So if you go onto the platform and you tell them you live in Birmingham or you work in Birmingham, it'll give you Birmingham specific advice and it will help you connect you with some of the local offer. The brilliant thing about Moving Medicine is it's designed by healthcare professionals for healthcare professionals, but it's open to anyone. So if you're a teacher, if you're a social worker and you want to have a nose, feel free, go and have a look. What it does is it provides resources to how to have the conversation about physical activity in less than a minute, 5 minutes, or if you've got a longer consultation or an ongoing relationship with the patient. It answers questions about how can you advise patients who say, you know what, I get physical activity, but I've got a lot of pain, or I have angina, I'm worried about my heart. How can physical activity help? Won't it put more strain on my heart? The whole point of Moving Medicine is it responds to some of the common symptoms, the common barriers that we see as clinicians in practice, and gives you useful tips and hints on how to have that conversation, but it also gives you the evidence base. So you can be confident that the advice you're giving is safe and is linked back to the evidence of what works. There are other resources available, and you can read these through the links in the pack that goes alongside this. There's also information in the pack around what's available in Birmingham. If you live in Birmingham and you pay council tax in Birmingham, or you receive benefit for council tax, you can sign up for a free leisure card in one of our local leisure centres. And there's a lot of activities available, both in the leisure centres, but also in our parks. So do have a look. There are lots and lots of opportunities to be active across the city. And when you're working with clients and patients, this is important to be aware of. You know, not everyone's going to rush to a gym. Not everyone wants to get back into sport, but they might be interested in a heritage walk. They might be interested in going to Ramblers. They might be up for trying out cycling in one of our specific groups to support people to get back into cycling and feel safe and confident cycling in the city. They might even get back into the pool. There are lots and lots of different things on offer, and these are just some of the resources out there to help you get to them. There are more webinars if you'd like more details and you'd like to learn more about, say, physical activity in children, physical activity in pregnancy, physical activity in mental health. We've got some really detailed webinars that were developed by one of our sports and exercise medicine doctors a couple of years ago that are available on the Healthy Brum YouTube channel. Just mentioning sport, and of course we've recently had the Commonwealth Games, there's a whole suite of resources developed by a different sports and exercise medicine registrar, which celebrates the health impacts of different sports. So whether you're a rugby fanatic or you're a fan of squash or you like to go running, have a look at the posters, share them with your patients, put them up on the notice board. I certainly learnt a lot reading the posters. They're colourful, they're interesting, and they might inspire someone to have a go and get involved in sport again. So I hope today's been helpful. We've given you a bit of an overview of physical activity. We've talked about it specifically in the context of being a Bolder Healthier Plus champion and how you can integrate brief advice on physical activity into your daily practice. Physical activity really is a wonder drug. It is that magic thing that actually all of us can do at every age that makes a difference. Whether you're working with someone who wants to improve their mental health, or someone who's got a health condition, or someone who's trying to prevent a health condition because of a family history, physical activity will make a difference. It's really important that all of us work to make Birmingham a really active city, because we know if we do, not only will we drive down some of the challenges we have as a system in terms of the costs to health and social care, but more importantly, we'll give our citizens better lives. We'll give them longer lives, happier and healthier lives. And ultimately, that's what we're all about. So I hope you found today's webinar helpful and you've learned something and you're going to take it and share it in your clinical practice as you move forward. So thank you very much for joining us, and I hope to see you at a future event.